Okay, I want to welcome everybody to Pediatric Grand Rounds. I'm going to start with our land acknowledgement. We would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We're proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. It's a pleasure for me to introduce today our speaker for Grand Rounds, Dr. Robin Adcock, who serves as the Director of Integrative Medicine for the Stead Center of Pediatric Pain, Palliative, and Integrative Medicine at UCF Benioff Children's Hospitals and in the Department of Pediatrics. Dr. Adcock is a doctor of acupuncture and Chinese medicine, a licensed acupuncturist, and a certified massage therapist. She's trained and practiced for 30 years in East Asian medicine, manual therapies, holistic healing modalities, and movement therapy and martial arts. Her research focuses on acupuncture and acupressure for children undergoing surgery or treatment for pediatric cancer. She serves as the executive director of the California State Oriental Medical Association, where she advocates for state and national policy change to expand patient access to integrative medicine. She also serves as the publisher of the peer-reviewed Journal of Acupuncture and Integrative Medicine. It's a great pleasure now to have turn over the podium to Ra. Thank you, Ra.
Thank you, Dr. Hirsch. All right. Good afternoon, everyone. Thanks for joining Grand Rounds. We have a lot of people joining from Zoom at home. Hi, everyone on Zoom. So for part of this, I'm going to be standing here, and for part of the program, I'm going to be stepping just to the side of this podium, and we're going to do some interactive movement. So a lot of times when I talk, I focus on acutherapy, acupuncture, acupressure, and all of the modalities from Chinese medicine that we have been bringing into the pediatric hospitals and clinics here at UCSF. Today, I wanted to put on more of my Director of Integrative Medicine hat and give you an update about what our Integrative Medicine division, a very fast-growing division, has been up to. And I hope you find it interesting. So we're going to talk about integrative medicine. We're also going to talk about integrative medicine techniques that we can all do for self-care. Because I think one of the best ways to experience integrative medicine is to see how it works on our own bodies. It helps create investment and understanding of the modalities and helps us be that much more informed in recommending it and in consulting for it for our patients. So I hope you enjoy the balance of both. I'm going to do a lot of the talking on the front, and so you have time to eat before you have to use your hands or body to move around. So thank you for introducing me, Dr. Hirsch. I'm the Director of Integrative Medicine. I'm a doctor of acupuncture, Chinese medicine, licensed acupuncturist. I love martial arts. I love dance. I love movement. I love manual therapies. It's been such an honor and my greatest dream to bring that into the hospital. When I'm not here, I'm chasing down hot springs all over the world that I can soak in and enjoy. And I love strong Earl Grey tea, which I avoided this morning so I don't talk too quickly. I have no disclosures for our talk today. And our goals today are to understand a little bit more about the pediatric integrative medicine services here at our 2 inpatient campuses and our 3 outpatient clinics at UCSF. I'm hoping that you learn a simple 3-point acupressure protocol that can be great for you or for your patients to relieve pain, nausea, and anxiety, and then also learn some self-care techniques for resiliency and maybe helping to prevent any provider burnout that you may be experiencing. With everything that we're going to talk about today, I think the unifying theme is looking at how we can create invitations out of a sympathetic state and back into a parasympathetic state. And my experience is that most of us here at the hospital, our patients and ourselves, it's a fast-paced environment. It can be high stress, and certainly for our patients. And every invitation that we can create to help relax and calm our nervous systems for ourselves and for our patients, I think nurtures the entire system. So if there's one unifying theme of everything we're going to talk about today, it's how to go into that parasympathetic state and ways that we can achieve that. So I've embedded 3 pauses here, and we're going to start with a pause right now for 3 different breathing techniques because of all the ways that we can invite parasympathetic state. The fastest, easiest, and most accessible is through our own mindful breathing. So I just want you to take 30 seconds, if you're willing to take 4 belly breaths. And if your hands are full of sandwiches, that's okay. But a nice way to do a belly breath is to have one hand on your belly. Some people like one hand on their chest or over their heart as well. And just see if as you breathe in, if you can feel your belly pushing against your hand. So we're going to do 4 breaths. This takes less than 30 seconds, and yet it can totally change your nervous system in less than half a minute. So let's just do 4 breaths in through the nose, feeling that belly get round and full like a big balloon. You can hold that or just let it out. Have awareness of the breath coming in through your nose, belly getting big and round, and exhaling out. Let's do 2 more of those. Another nice belly breath. And a last one. That's less than 30 seconds. Sometimes I do this after a challenging patient interaction, or if I'm going into a difficult meeting, taking 30 seconds to just come into the breathing can make a huge difference. With kids, when we come in, most kids and families have an understandable level of anxiety while they're here. There can be anxiety specific to conditions or infusions that are happening, but a lot of it is just expected anxiety from being in this environment. And taking 30 seconds before we have a patient interaction or in a patient interaction to breathe together can make a huge difference. I like this image of the stuffed animals on kids' bellies because that's a really nice way. They almost all come in with a stuffy, and it's a really nice way to play a game and have, we have medical play. I like playful medicine. So this is kind of playful medicine where you can have a child put their stuffy on their belly and see if they can give that stuffed animal a little ride on their belly. Yeah. Okay, our integrative medicine division is a really fast growing team right now. So these are just some of the clinicians. There's also someone else here in the audience, Robin, who's one of the nurses that supports integrative medicine. I didn't have a great picture of you, Robin. And so these are our clinicians: massage therapists, licensed acupuncturists, nurse practitioners, medical doctors, and nurses, all working to support the integrative medicine team. So these are the ones directly delivering the therapies that fall under integrative medicine. I just want you to see their faces. So if you see them out in the hallways here in Oakland, you have a sense of who they are. One of the first things we did as a team, since we've gone from having a few services to creating an entire division of integrative medicine. And one of the first things that we did was sit down and figure out guiding principles for this. We wanted integrative medicine to be defined by more than just the modalities that it offers, and realize that integrative medicine is a philosophy and an approach to health and healing. So I'm going to run through these quickly because these are what are helping to guide all the decisions we make as we grow our services. And really the first is that integrative medicine is meant to be used in combination with standard of care. This is not a competition, right? We're here to improve outcomes through the best of both worlds. So it really is a collaborative effort between the existing standard of care that is here and these new therapies that we're bringing in. And the therapies that we're bringing in are evidence-based. So we're researching and trying to find where there's evidence in a pediatric population and figuring out how to create appropriate service from that evidence that's already out there. And we're also focused within that evidence of patient-centered outcomes. So we're not just looking at pain scales, we're also looking at the patient experience, and that those are really important in evaluating integrative medicine. We see patients and patient families as active partners in health and healing. So there's a lot of focus on delivering education for tools, self-care tools that families and children can do at home. So it really is a partnership with our families for this medicine. Integrative medicine honors the mind, body, spirit, and community as factors in health determinants. So we're really trying to look at the whole picture and value all of those equally. Again, this is just doubling down that education is an essential tool. There are many barriers to integrative medicine, and we're going to talk about some of those, but one of the biggest is a lack of education. What is integrative medicine? When should I use it? When should I consult for it? Why would I want it for my child? And just because so many of these modalities are new in this setting, Many of them are old, 2,000 years old, but they're new in these settings. So we really have a lot of work to do over, I think, the next 10 to 20 years easily about educating about these modalities and why we would access them. We're very supportive of all of these modalities and our practitioners operating at the high standard that any other department functions at in this hospital. And we're concerned that right now there is not equitable access for everyone to integrative medicine based on many factors. And so we know that advocacy and policy development are also an important part of the work that we're doing. So when I mentioned some health disparities, and I wasn't quite sure where to drop this in because it could fit many places in the program today, but I wanted to just bring it to you now so that everything else that comes after this, you can frame around some of these barriers. So there are many papers out there about health disparities for integrative medicine. This was a nice paper from 2017, 2016, and it looks at 4 major categories of barriers for the underserved communities to access integrative medicine: awareness, availability, accessibility, and affordability. So awareness, it goes back to that piece about education. There's a lack of education about many of these modalities. Acupuncture, acupressure, massage, biofeedback. We're going to look at those modalities, but there's a lack of awareness because they have not traditionally been part of standard of care. So many providers and families have no exposure to it. There can be cultural barriers to accepting some of these medicines, about being able to receive manual therapies comfortably, or something that comes from Chinese medicine sometimes can create a barrier for other people depending on their culture or upbringing. There can be generational gaps. We find that older generations are less likely to accept these medicines versus younger generations. So it can depend on a caretaker for a patient that's here, whether they've been exposed to these therapies or not. Availability, a lot of these medicines are not available in lower income regions. If you go into a low income area, you're not going to see massage therapy or acupuncture or any of these services in that community. You're not likely to find that. So also with rural areas. So patients just don't often see these things or have exposure to them. There are what we call healthcare deserts in places. And when there's a healthcare desert, integrative medicine is not going to be part of that setting. Accessibility, for a lot of families, they're not able to access these. They have work schedules. They can't get transportation for medical care that goes above and beyond standard of care. They have childcare issues, and there can be language barriers. Affordability, certainly the cost. Many of these therapies, if you seek them privately, are cash pay. And when we're on fixed incomes or low budgets, that's not something that gets incorporated into a budget when rent and food take priority. So these are just a few of the barriers that we face. There are many and more subtle ones.
What about covered by, even for people with private insurance? My own child was once referred from the UC 17 clinic to an outpatient integrated provider at Osher. It was like 15 years ago, Osher Stairs, and it was not covered by our wonderful UC insurance.
Yeah, so there's varying levels of coverage. So you're not likely to find, like, for example, massage therapy is very rarely covered. Acupuncture and acupressure, we're starting to see covered. It is part of the Medi-Cal healthcare system, and it is considered an essential health benefit in California under the Affordable Care Act. So we're seeing increasing benefits, but it's going to take far more advocacy to make sure that there's equitable access to this. So that's a great question, and it's definitely more work to do for those of us that are practicing this. So just in some of our call to action for this, as we think about how do we help our patients access integrative medicine, is we first and foremost have to identify our own conscious or unconscious or implicit bias. What are the biases we have? I hear a lot of people like, oh yeah, there's just not much research for acupuncture. Well, that's a bias because there's tons of research out there, right? So it's important for us as providers to look at where we welcome these in our life or where we feel that they might not help our patients. We need to all focus on education, educating ourselves. Thank you for being here today to educate yourself about integrative medicine. Trying integrative medicine for your own healthcare if it's something that you want to learn more about. Thinking as teams about how we innovate creative programs to expand access, to create more engagement from our communities and other providers in integrative medicine, how to generate more support for this. These services take a lot of philanthropy and foundation work to provide them to our patients. We need to advocate for patients to access this, because what's true is when you dive into the research, you'll see that these therapies create improved outcomes. So we have an ethical responsibility when we know there's improved outcomes that can happen to do the advocacy work within UCSF, within our teams, within our departments, within this organization, at the state level and at the national level, to try and expand access to this medicine for all families that want to engage with it. We do a lot of training for clinicians in integrative medicine so that they can deliver part of this, because we do have a limited team. And the more people that know integrative therapies, I hope you're going to walk out with a few tools today for patients, the more that we all learn this. This is a people's medicine, a lot of these. It's meant to be spread widely. And while we have specialists in this, you don't have to be a specialist to be able to use some of these tools to help your patients and yourself. And as clinicians, it's important for us to realize that some families need more education or more proactive outreach to accept a consult. Two families might be offered the same therapies, and the ones that have had an exposure to it before or education are more likely to say, yeah, I'm gonna be interested in that for my child. Whereas other families that maybe haven't had exposure or have some of those barriers we talked about before are going to need more time to accept that initial consult. So these are just some of the ways that we're trying to break down barriers here with our service at UCSF. Our team's really interested in research, right? So we're really trying to dive into the papers that are out there and ask the questions so that as we grow this division, we're doing it in the best way possible and utilizing the resources that we have to make the greatest impact. So we're doing a systematic review right now, and our research question is, what are the best methods and tools for measuring pediatric acupuncture treatment outcomes? So we would love to do all integrative medicine, but we would have been reviewing about 20,000 articles. So even just narrowing it down to acupuncture, we started with about 4,000 articles that we, for our initial review for the systematic review. And the reason this question is so important is because a lot of the measurement tools that exist right now are looking at symptom management. They're looking at, does the pain score go down? Does the VAS change? Does a BARF score change? But what we find with integrative medicine is that there's this other thing that happens. There can be a reduction of symptoms, but there's an increase in resiliency, in coping. Patients will often say, usually they say my pain is less, for example, but I also hear, my pain's about the same, but I feel like I can deal with it better. So that's really shown me that there are two things functioning at the same time in these therapies that we're delivering. And while we want to see that pain number go down, we want to know how to evaluate the coping and resiliency. So we're looking at all the existing research right now to figure out what are the best ways to measure these therapies. We plan to embed that in all of our workflow, in our note templates, and be able to go back and do retroactive studies to understand how these services can make the greatest impact. So this is a really fun paper. We'll probably come down to about 200 papers that we'll be doing data extraction on, and we'll be moving into that stage. So we're maybe a year away from publishing. It's been a great collaboration between the Stodd Center of Pediatric Medicine and the Osher Center. We also have a proposal in to study, does auriculotherapy, I'll tell you what that is in a second, can that reduce post-surgical pain for pediatric patients? And in this case, auriculotherapy would either be ear acupuncture or ear seeds. And I hope you're taking these little cards as you come in, because we're going to play with ear seeds at the end of today's talk. So this is another pilot study that we hope to get started within the next year. One of the other things we did in fiscal year 23 was survey our integrative medicine patients to understand how is the service landing and how is it affecting kids. And while this was a really big study and report that we put together, I want to give you a couple highlights. So these surveys were filled out with nursing teams, with families, with parents, and with the IM clinicians that are delivering specifically acutherapy and massage therapy. And a couple interesting things that we found. Now, on our integrative medicine list, we hold about 25 to 35 patients on a daily average census. And about half of those will be consults that come to us from either our pain consult team or our palliative care consult team. So I want you to know that some of this data is being generated by patients that are having some of the more difficult experiences here at the hospital and need these additional consult services. So about half of these folks are pain or palliative patients, and the other half are integrative medicine patients that come to us from other departments. So these numbers are going to be slightly skewed towards having more severe symptomology just by the nature of the patient population that we most commonly work with. But what we found is that the patients that we see need more symptom management. even with the best interventions and best standard of care and best pharmaceutical support, children here that we see need more symptom management. And they need more kinds of symptom management that are approaching their body from different perspectives. So while we see patients for many different symptoms, we just looked at the 4 main most common ones that come up: nausea, fatigue, pain, and anxiety. And of all the patients that we talk to, 38% are still having nausea despite having medical management or other therapies, other interventions. 50-something% are having fatigue, 80% pain, and 85% anxiety, which just goes back to that piece that anxiety is a huge symptom that families are dealing with, and why I'm going to keep focusing on parasympathetic support in a minute. Moreover, not only are patients having these symptoms, but they're having multiple symptoms at the same time. So what we found is more than 80% of the patients report 2 or more of these symptoms. Right? So there's a heavy symptom burden that kids are dealing with. And this is the good stuff here. This is what helps us get more funding and more support for integrative services, is that after we see these kids, they feel better. And oftentimes their symptoms go from maybe a 5 zone to a 3 zone. So they're still having symptoms, but the difference between a 5 and a 3 on a 10-point scale of these symptoms can be the difference between another PRN dose, or their ability to get up and do physical therapy, or enough nausea management that they're able to start eating and heading home. So I think a lot of these numbers, we would be happy with medical management for the numbers to go down by 2 points, right? And to think that we can do a non-pharmacologic intervention and see a 2-point average reduction for these symptoms is pretty wonderful, and it shows how all of this can work together. Finally, and we love this, people say, well, what are the side effects? So one of the most common is a nap afterwards. So after we see patients, about a third of all the patients we surveyed fell asleep after we see them. And that's about a quarter of adolescents and children, and about 2 out of 5 babies fall asleep and have a really nice long nap after we see them. So this kind of makes us popular around the hospital, especially in the ICN. So I think it's nice because when patients are able to sleep, they're able to heal better. And what's true is with night cares and vitals and just everyone coming in out of their room, most patients are really exhausted, but they're wired and tired. And when they can get a nice nap afterwards, not only is that patient heal, the whole family unit is supported by that. Parents can go and get a coffee, take a walk, make the calls they need to do, and know that their child is resting comfortably. So I don't want to underestimate how important it is to be able to invite sleep in this hospital. Okay, time for another breathing. We did our belly breathing. I told you we're gonna have 3 breathing breaks. So this is finger breathing. This is another great tool. If you see your kids having shallow breath, or they're anxious, or you notice that in yourself, another way to bring in mindful breathing is hand breathing, or sometimes people call it starfish breathing. All right, so let's do let's do 2 or 3 of these. So you can take your hand, you don't have to put your sandwich down if you're eating, you guys, you can imagine it, but you can take your hand. This is a wonderful way to invite kids into a mindful breathing. And again, it's like playful medicine. So we're gonna inhale up the thumb. You can hold at the top if you want, and exhale down the thumb. And inhale up the pointer finger and exhale down. Let's do all 5. Inhale up the middle finger and down. Up the ring finger, and exhale out. And one last yummy finger breath, up the pinky and down. What's that, 20 seconds, right? 20, 30 seconds. It's a great way to change the state of our nervous system. So we've done belly breathing and finger breathing, 2 easy tools to help ourselves or our patients come into a more relaxed state before any interaction. Imagine if we took a minute to breathe with each other before we had as many interactions as we do. So we're talking about integrative medicine. What are we doing on integrative medicine? These are just a few of the therapies that we're offering here. Acutherapy, the only reason that started is because normally this slide I go in and do a deep dive in acutherapy because that's my specialty, but it's no more special than any other here. Acutherapy, which includes acupuncture, acupressure, and many other modalities that come from Chinese medicine, massage therapy, mindful breathing, which we're already doing together, aromatherapy, which is now at this point on the floors so that nurses can access it as well. Our team also does specialized aromatherapy for patients with great result for stress, anxiety, nausea. We do clinical hypnosis and guided meditation. Many of our clinicians are trained in this. Biofeedback, heart math devices, if you've ever seen those. We use electrical stimulation devices, TENS units, and a relief band that's used for nausea on the inner wrist. And we often partner our services with art therapy, pet therapy, or child life for procedural, for difficult procedures, or for kids that have sensory processing differences, and maybe need music to be able to feel comfortable to get massage, right? So we have a great partnership in the hospital in that. I want to remind you that, I don't have time to deep dive into these, but when we talk about massage therapy, we're delivering very specialized massage therapy here. This is not what you go to like Massage Envy for. And those are great clinicians there, great practitioners. But our team here are trained in a very long list of modalities that are specialized for hospital-based massage therapy. And that's different than a relaxation therapy on the weekend. So you can just look at the long list here. We have 5 massage therapists on our team now. These are just some of the modalities that they're delivering that are highly specialized for what patients need here. So neurology, neonatal massage, shiatsu, myofascial release, cranial sacral therapy. I'm also a cranial sacral therapist. We do a lot of this with kids with pain, with neurological problems, and with infants here with great results. Manual lymphatic drainage is something we use a lot for patients with edema and our oncology patients. So I just want you to know that when you see our massage therapists here, don't call them a masseuse. They're massage therapists. They're very highly trained and specialized, some of them for more than decades, multiple decades. When we talk about acutherapy, this includes acupuncture, and you'll see a lot of acupuncture on consult orders. When I got here, I really wanted to de-emphasize the word puncture. I think that word in and of itself is a barrier to care in a pediatric patient population where needles are considered the most traumatic exposure that they will have in any medical procedure. So we renamed the service acutherapy because acupuncture is just one of many interventions that's offered from this service. But we do a lot of acupuncture here, and kids love it. So, so we do acupressure. We do ear acupressure seeds, which we're going to talk about. We do non-needle acupuncture that comes from a tradition in Japan that uses touch tools to basically do the same thing, but does not have to puncture the skin. So this is good for thrombocytopenic patients or immunocompromised patients, needle phobic patients, anticoagulated patients. So we are able to deliver non-needle acupuncture here using specialized tools. We do cupping therapy, which is wonderful, especially for chronic pain patients and migraine patients, medical massage and Qigong, which we're going to do together, and a lot of caregiver education. I just want you to see some faces of kids because a lot of times I think people are like, ooh, acupuncture, that's really scary. And it's really not. An acupuncture needle is about the width, the gauge of one strand of your hair. So they're flexible little wires, sterile, single-use, disposable needles, and kids love it. The goal is never to get a kid to do acupuncture if they don't want to. All of us try to meet patients where they're at and gently invite them into the next level of health. So needlework is not the ultimate goal, but for those that where it's indicated that are interested in it, and for most kids, it's their first exposure to it here. We love being their first exposure because we know we're going to give them a great experience with it and give it to them just when they're ready and comfortable with it. So this was a patient that was here for our paper program. I see Dr. Bernal in the audience here, which is his amazing program with Dr. Benke, who's also in the audience here. So it's their program that they oversee, and it's been beautiful to provide acutherapy there. This patient had never had acupuncture or had very little exposure before, and it's become one of her favorite therapies along with cupping. So I just wanted you to see that shining face with needles in. It's not what you would think of normally. A lot of the acupressure that we do, I always try to engage patients in the therapy for themselves. This was at this point, this patient was just under 2 years old. We started with him when he was under a year old, and he had a lot of provider phobia. He had had a really traumatic start to a neuroblastoma diagnosis here and was in the PICU for a long time and was afraid for anyone to touch him. And we found that procedural touch is done so beautifully here, but it can be really hard for kids. And they start to associate hospital touch with procedure. And one of the beautiful things of the manual therapies of our division is that we're able to start deconstructing that response in kids and give them therapeutic touch that is comfortable and nourishing and can help them be more comfortable with procedural touch at the same time. So this little guy, Zio, he became so interested in acupressure that at one point I was trying to teach his family, who were overwhelmed that day, about some points they could press for his nausea and pain. So I took a little surgical marker and put some dots on his skin. And I turned around talking to his parents for a few minutes. He starts pressing his own points on the dots, and he put himself to sleep while we were talking. And every treatment after that, he would engage with acupressure very actively, pointing to points that he wanted, using tools that I provided to him, and then providing acutherapy to his stuffed animals and his parents. So this is just amazing that kids can, when we have medicines that they feel help them and they can engage with it, it becomes a life-changing tool for them sometimes. And that's what we really want, is to give them better care while they're here, but to change the course of their life and give them more tools so that they can use at home afterwards. So I just wanted you to see a few examples of how this plays out. In addition, our integrative medicine service is looking, as we try to find where we can make the greatest impact here with the resources we have, we're looking for special partnerships where we can fill a gap in care for patient populations that need more support. So this is an example in the Cardiac Grant program, which stands for growth and neurodevelopment. So for neonates that have congenital heart defects, they often need to have a lot of sedation to keep their pressures stabilized. But that happens at the detriment of neurodevelopment. So this team of cardiologists and all the team came to us and said, can we add in massage and acupressure and help decrease agitation and also support neurodevelopment? And we started working with them, learning more about their patient population and how we could help. And we were able to develop a protocol that we deliver now and that we teach to both the nurses that work on this floor and the NPs, as well as the families. So we have a standardized education tool where we're teaching comfort holds or containment holds or hand swaddles. This is wonderful because it helps families that maybe aren't able to hold their child in their lap or in their arms to be able to hold their child in a safe way. We're teaching them acupressure points that help with agitation, constipation, and other issues. And it's been a beautiful partnership, so much so that the cardiology team presented this at the World Congress of Pediatric Cardiology in August. So it's a beautiful example where we've been able to come in and use integrative medicine to uniquely develop protocols to support a patient population that really needed more care than we have in our hands right now. We also do a lot of training for nursing teams, and we've worked with social work, with adolescent medicine, with the ICN nursing team, with the nurses in the cardiology department, where we're teaching them a lot of these same protocols that are helpful, basically trying to give 1-minute interventions that nurses can do at bedside that can help make the day go better for them, for their patients, for the whole unit and family. So this was a great class, a 4-hour class that we delivered earlier this year. So if you're a consulting provider or if you're looking to have more support, these are just some of the reasons that we are consulted. For integrative medicine, you see this is not an exhaustive list either. So, we can directly provide care to patients. We can provide parent education or caregiver education. And we're also willing to work with departments, just like we are with cardiology. We're doing similar things with neurology, with adolescent med for disordered eating patients. We're developing specialized programs to help uplift and support their patients. So do think of us if you're wanting another level of support. And when you think of us, how do you do it? So everyone knows IP3, right? But guess what? We're changing our name. IP3 is no longer IP3. I mean, we still are, but now we're going by PPIM. And that's because we joined with Oakland and we wanted to become one division. So we created a new basket to hold all of us. So PPIM, pain, palliative, and integrative medicine. So you're going to look for a PPIM consult. The big key here is the consult needs to go to PPIM, and then our providers consult massage or acutherapy or other integrative medicine services from there. So if you consult PPIM, you'll see you can select which services you're most interested in for your patient. You can select the symptoms or indications for that. But please, I'm just trying to, it's a little it's a little counterintuitive, but don't directly put in a pediatric massage therapy or a pediatric acupuncture. Soon that will say acutherapy as we change apex, or even an integrative medicine consult. Consult's got to go into the top of the umbrella, and then we will get consulted from there. Okay, here's our third breathing break, and then we're getting into a super fun time of the program. So I hope you're finishing up your lunches because we're going to be up and moving in a minute. So we've done belly breathing with the hand on the belly and hand on the chest. We've done finger breathing or starfish breathing. This is box breathing. And who's done box breathing? Anybody ever seen this before? Yeah, there's some hands up. So let's just do a couple of these. It's going to take less than a minute. Let's do 2 box breaths. So basically you can pick any square. If you're really good, you could use this rectangle. You can do rectangle breathing, and you'll inhale up on the side and hold it across the top. Hold your breath just for a moment, letting that breath settle, and exhale down the side of the screen, your eyes tracking the edge, and then hold that exhale across. So now that we've practiced it, let's do 2 more. We're going to inhale and hold, letting all that wonderful oxygen come into your lungs, and we're going to exhale down. And we're going to hold that exhale, just feeling that emptiness, knowing that a fresh breath of air is waiting right behind it. And inhale up the side, welcoming all that oxygen, that chi and prana, relaxation, and holding it. And exhale down and hold that. I think it's hard to go right to box breathing, which is why I put it third. If your heart rate is up, it's hard to suddenly hold your breath. So I like to start with belly breathing, finger breathing, and then going to the more advanced box breathing. But any of these can be done as a standalone experience, and in 30 seconds or less can change how you're feeling about a moment within your body. So yeah. You guys ready to do some movement? Did you guys all pick up the cards? I made little cheat sheet cards for you so you don't have to memorize everything we're doing. But if you are so willing and you want to feel amazing, my Qigong teacher, I'd love to do some Qigong with you. My Qigong teacher said Qigong makes us happier, healthier, and more beautiful. So who doesn't want that, right? So Qigong is an ancient practice. It consists of physical movement, meditation or mindfulness, sometimes visualization, and breathing. And is there evidence behind it? Qigong became pretty popular when COVID was hot and heavy in 2020. We were seeing Qigong supporting a lot of patients in China. But this is coming from the NIH. These are just some of the benefits that have been shown through research that Qigong can provide. So this is a really nice list of specific things. But even if you just pick chronic pain, or reducing anxiety, yeah, that's good. Let's do it. But if you have more reasons to do it, all the better. This is a study that I like that showed out of a meta-analysis that looked at 19 controlled trials for Qigong and found that Qigong's beneficial for life, sleep quality, balance of the body to help prevent falls, especially as we get older, hand grip strength, flexibility of the trunk, right? Blood pressure, heart rate. So these are all good things. Let's do some Qigong, all right? So if you're willing, come on, it's gonna be fun, I promise. Let's stand up. And all I want is for you to have enough room that you're not going to hit your neighbor if your arms are outstretched. All right. For those of you at home, I've got to step to the side. My Zoom friends, I'm so sorry, but I got to step to the side so everyone can see. So we're going to, the first thing, you can let your arms come down. And the first thing we're going to do is stand. And I know we stand all day, but there's different ways to stand that either support the flow of energy and help reduce stress in our body, or can actually generate stress. So first, let's stand the way so many of us stand. And I'm not picking anybody out. I'm not singling you out, but I know you know who you are. Let's stand with our knees locked, right? You're in line, you're stressed, you're trying to get your lunch, you got to get back to see your patients. We tend to stand with our knees locked. This hyperextends our knees and changes the whole curve of the spine. Now I want you to just slightly bend your knees and see what happens. Do you notice that your pelvis shifts, that your spine aligns? And now suddenly we're able to come into a better alignment. So let's just practice this stance. Our feet are going to be about hip width apart, knees slightly bent, shoulders over our hips, hips over our feet. We can bring up our shoulders, bring them back and drop them down, and then just gently bring your hands in front. This is a classic Qigong stance. And it's said that if you just hold this stance with a few deep breaths for a minute or less, that you will notice an increase of energy in your body. When we stand this way, we're able to support the flow through our body and not place any strain on our joints. And you just take a nice breath, maybe do 2 belly breaths while you're here. Just notice your body. See if you can relax your jaw, drop your tongue from the roof of your mouth. Let your eyes fall back into your head. Great. All right. And now we're going to come out of that. And we're going to just invite some circles into our joints. So when we're feeling stressed, I do this in the morning before I even get out of bed. Warm up those joints. The warmer synovial fluid is, the more it buffers us and protects us and helps prevent shock to the joint. So let's turn our head right to left. Let's go to our neck. So we're going to just look right and left in a nice Qigong stance. Have you locked your knees yet? If you have, just bend them slightly. When you look to the side, now let your eyes keep going beyond your head. Go back to the other side. Let your eyes stretch. Turn your head one more time. Stretch those eyes as far as they can. And back to the other side. Great. Let's roll our shoulders forward. Almost all of us from our computers and driving, we're all tight here. We all want someone to rub our shoulders, but we can rub our own. Bring those shoulders forward. And when they go back, squeeze your shoulder blades together. And let's go back the other way. And you'll notice as the shoulders go back, what a great time to invite a breath. And now I love this series. So we're going to now roll one shoulder. We're going to touch our shoulder with our hand and roll our wing. And now we're going to reach that arm out and inhale up and look at your hand as it circles behind you and it invites a gentle spinal twist. Gorgeous, you guys. Let's roll the other shoulder and roll your wing and reach that arm out and stretch it up and inhale and follow your hand with your eyes. Let's do that one more time because you're so good at it now. Roll the shoulder back, roll the wing back. Bend those knees. Are your knees locked? Inhale up and around. And last time on this, roll that shoulder. Roll your wing. Reach out, reach up, inhale. And come back down. Yeah, hips, you guys, hips, hips. We sit, we're driving, so much stress in our hips. Are your knees straight or are they slightly bent? Circle those hips around. Let's go the other way. There's something about creating circles in the joint that helps the whole flow of what we call qi in Chinese medicine move through our body. Let's do our knees. You can just do a little circle with your knees. Be careful if you have a knee injury, and the other way. And let's do our ankles. So just like clutter in a room, qi gets stuck at the corners, right? You can look at your house and you'll see all your stuff is going to be stuck in the corners. It happens in our body too. So anytime we can invite circles into our joints, we create more flow. I call this a cup of qi. You don't need coffee. It'll save you $5 a day if you do qigong instead of go get another piece. Okay, so now that we've done this, let's do a couple movements. We're going to inhale, reach up and grab that sky. And we're just going to pull down some of that sky energy, whatever you like, the warm sunshine out there, the blue sky, the moist clouds. Inhale up and keep those knees slightly bent. Have you locked your knees? And one more time, inhaling up. And in all these movements, what we're looking for is this sense of flow. It's about feeling flow. Let's do the opposite. Let's pull up from the ground and throw it up to the sky. And exhale out. Pulling up, inhaling. Throw it up to the sky and exhale out. And there's such beautiful, smooth, flowing movement here. Inhale up and out. These are all things that invite energy into your body. If you're feeling sluggish, tired, grumpy, cranky, any of those things, right? Qigong can be great for clearing things. If you're having a difficult moment, you can do any of those breathing exercises, but if you need a bigger physical embodiment of kind of clearing your space, there's two things I want to teach you. So one is called like sweeping your porch. So we're going to start with our hands out to the side. One hand's going to go in front and the other hand goes behind. And the movement is generated by bending your knees. So you bend. The arms basically do their own thing. We're not moving the arms. The arms, now that they're going, they have their own momentum. This is a great way. You're basically like brushing it off you. Whatever's in front of you or behind you. It's a great way. You can do a minute or two of this as you're leaving, and you can just let the day go. Great. So that's called sweeping the porch. If things are a little more difficult, we can do what we call the zebra shake, right? So the zebra getting chased by the lion, we're going to shake. We're going to start with our hands, shake all the way up to the elbows, to the shoulders, and just drop it down. Like, do I need to get that difficult patient interaction off me, or the stress from home I don't want to bring into work? One more time. Shake it, shake the shoulders, drop it down. Yeah. Okay, 2 more exercises. I like this one. I know Dr. Sun likes this one too. We're going to start with our feet a little bit wider than our Qigong stance. Bend those knees slightly.
And this is all about cultivating flow. This is like when you come to work and there's not a single red light or car in front of you, right? Can you imagine? This is what it feels like in the body. So we're gonna bring up a hand, serve up a cup of tea. And as that hand circles and comes down, the other hand's gonna come up. And now you've got this infinity sign or this figure 8 happening. So you might be a little heady with it at first, but get out of your head. All you're doing is 2 circles, counter time together. So once you feel like you have this, I want you to stop thinking about it, keep doing it. And what I want you to cultivate is the smoothest sense of flow you can find, where there's no static movement, there's no stopping point or jerking point. It's just smooth flowing. And the lesson of this, because there's always a philosophical piece to this, the lesson is that we can have a high moment, but what comes next is perhaps a low one, but another high one is coming. Day becomes night. Summer becomes winter. And it's really about not getting stuck in any of these moments in our emotions, in our life. It's about not getting stuck and about letting the flow continue to happen. So I love this figure 8. You guys look gorgeous doing it. And we're going to do this last one, which is why I needed you to have room, because we're going to swing our arms around. You see this in parks everywhere through San Francisco. This is one of the most famous Qigong exercises. You can do this for 20 minutes a day. You can do it for a minute in the stairwell when you want to boost your energy. So what's great about this is doing both a kidney tap behind the back. The kidneys in Chinese medicine are your batteries. So we're charging up your batteries. And we're also supporting digestion. If you just ate a big sandwich, don't tap too hard, you guys. So tapping here. And you'll see people doing this in parks all through San Francisco for thousands of years. I call this what we just did in 10 minutes, a cup of chi. I hope you enjoyed it. If you remember just one exercise from it that you liked, then you get an A+ for today. Have a seat back down, you guys.
All right, we got a couple more minutes and then we're going to move into to some questions. So if you liked that, this is one of my teachers, Dr. Suzanne Friedman. These are 3 books that she's written. So if you find that you're suddenly in love with Qigong, I love these 3 resources. One's focused on cancer, one is self-care, and that little yellow one in the center is all about doing clinical work with Qigong, because you can do Qigong on and with patients. Okay, acupressure. Who's done acupressure? Who's had acupressure or been exposed to acupressure? Okay, all right, good. There's so many people that this can be new for. So acupressure, it's the stimulation of acupoints on the body using fingers or tools for a desired outcome of therapeutic benefit. So you have all these special points on your body. In fact, the World Health Organization says that you have 361. As a doctor of Chinese medicine, you have more like 900 that I've learned, but I really only use about 50 of my favorites here at the hospital. And these points, they have been imaged in many different ways. So if you have a bias and you're thinking, yeah, they're not real, well, that's a bias that you need to check. They have been imaged in many different ways. I go into that in other lectures. But these points, when they're stimulated, can have very specific therapeutic outcome. So just any of these points have been shown to help reduce inflammation in the local area, regulate the central nervous system into parasympathetic activity, promote vasodilation to promote circulation, and release endogenous opioids and neurotransmitters. Now, the stronger these points are stimulated, the more that happens. So a dose of acupuncture is going to create this more robustly than acupressure, but that doesn't mean that acupuncture is always the goal. More is not always better. We want the right dose. So there's tons of research. These are just a few about what acupressure can do to help the body, but I just want you to see that post-operative nausea and vomiting, yeah, we see a lot of that here. Chemotherapy-induced nausea and vomiting, same. Pain in the body, cancer-related fatigue, insomnia. These are all symptoms that are well managed by acupressure, especially in combination with the standard of care we deliver here. So the most important acupressure point I can teach you today for your clinical practice helps with nausea. It also helps with anxiety, but we use this a lot for nausea. It's called pericardium 6. It's located on the inner wrist. Are you excited to learn it right now? Because I'm excited to teach it to you. So take a wrist, take your 3 middle fingers from your other hand and put your 3 fingers up against your wrist crease. Now swing your thumb around in between the 2 tendons of your forearm, the palmaris longus and the flexor carpi radialis. This is the acupressure point. If you want to know where those two tendons are, you can squeeze your fist and they'll probably pop right out. And there's a trench in the middle, and you want to have that point right in the middle of the trench. Now, take your hand away. Now that you found the point by measuring it, you can actually just slide your thumb up that trench, and you'll notice it's going to drop into this soft, mushy place. You've noticed how it gets softer and mushier right there? That's pericardium 6. This point is amazing for helping with nausea. And what's great is that it's something that families can do with their child while they're sitting and hanging out or watching a movie. It's something that an older child or adolescent can do for themselves. And they can do it at school. They can do it anytime. So this point is really helpful for nausea, so helpful that there are devices that we use here that are created to stimulate it. One is a C-band. It's called a C-band because it was created for nausea on cruises. So it's just an acupressure bead on a flexible wristband. The other gives electric stimulation to this point. We offer both of these devices here, but there's no reason that if you're with a patient that you can't show them this point and then consult us and we can come in with the devices. All right, that's the first point. Second point, some people know this for headaches. So now for this point, what I want you to do is squeeze your thumb into your hand, and you'll notice that there's this little mound of tissue that happens at the base of your pointer finger. Take the thumb away, it'll go away, it'll create like a bowl. But if you squeeze the thumb in, it creates a mound. I want you to find the highest point on that mound and press down almost perpendicularly into the base of your pointer finger. So you're coming at an angle this way into your hand. Now feel around in there for where it feels a little achy. Your pressing finger is going to feel like a nodule of thicker tissue in there. The receiving hand is going to go, ooh, that's achy or sore for most of us once you find it. Sometimes you've got to scoop it or come in from the side. You got to look for it and feel it. But usually I can tell when people land on it because their eyes get big and they go, ooh. Sometimes they'll feel it run up their arm. And if you haven't felt it right now, then you can stay after and I'll help you have that sensation, right? I loved helping people find this point. This is a wonderful point for pain. It's very famous for headaches because it's considered the command point for the face. So it really helps any pain that's happening in the face. And it's a wonderful point for migraine pain, frustration. All right. It says here, caution in pregnancy. We don't strongly stimulate this. Acupressure in pregnancy is okay. We're not going to put a needle in there and give you strong electric stimulation on this point until it's time to induce labor. But gentle acupressure is fine. Okay, last one. So now I want you to bend your elbow, bend your arm, and find the edge of the lateral edge of your elbow crease. And I want you to come down about 3 fingers or so. You can, in fact, you can draw a line between the edge of that crease to the thenar eminence here of your hand. So you're drawing a line down this part of your arm, and now you're going to come down about 3 fingers or so, up in this meaty, juicy part of your forearm, and feel around in there. You might have to scoop it a certain way or dig in there to find it, but this is a wonderful point to relieve anxiety, to reduce stress, and to promote circulation in the body. And if you're having a hard time finding this point, I'm happy to help you find it if you want to stay afterwards. So 3 acupressure points: pericardium 6 here on the inner wrist for nausea, the base of the pointer finger for pain or headache, and then up in the forearm for stress, for anxiety. 3 acupressure points. They're on the card, so you don't have to remember it all. I gave you a cheat sheet. All right, last thing we're going to do. I love this joke. It's so silly. Ear seeds. So ear acupressure. This is from the Cleveland Clinic. This is on their website, right? We need this on ours. Ear seeds have been shown to help all of these issues: pain, anxiety, acute or chronic pain, insomnia, stress. So ear acupressure seeds are literally an organic seed from the Beccaria plant that is stuck to an adhesive bandage that we stick on points. You can use them on points all over the body, but they're most effective for acupoints on the ear. It's just the right size and shape for stimulating acupoints. And the ear, because of the nerve innervation, and especially because of the vagus nerve innervation to the auricular branch of the vagus nerve, ear points have a way of whispering sweet nothings to the brain and stimulating and improving vagal tone. So why? Well, in Chinese medicine, there's microsystems all over the body, and the ear has been mapped out to almost be an upside down fetus. If you see here, where points in the lobe treat the head. In fact, the point that we commonly pierce is the eye point. And some people say that actually all the sailors would pierce this with gold to stimulate that point to improve their vision of finding land. So that's like going back that far of why we pierce that point. It's also a nice big chunky place to pierce. But then points along here treat the arm, the spine, and the digestive organs. When you study the ear in acupuncture school, it is about 200 points. It gets a little more complicated. But from an Eastern point of view, this is the model or the microsystem. From a Western point of view, at the very least, the auricular branch of the vagus nerve is stimulated with anything that happens with auriculotherapy. I've handed you this ear card that we've put together just to learn one point, the biggest bang for your buck point, that's located in the triangular fossa of the ear. So you find this little, I almost call this like a little bird or a little snake with its mouth opening up, and it's swallowing the seed. So the seed will be placed right on this point on the ear. If you want to stay, I'm happy to put it on your ear, but your card should help you get there, and you have 12 seeds. You can do both ears and give yourself 6 treatments, okay? So these ear acupressure seeds are amazing. We've been rolling them out. We have a tool that we give to families so that they can do this. And we just wrote a grant to start introducing this to staff in the emergency department in hopes that we will eventually be able to offer this to patients coming into the ED as an initial way to help them calm down as they have their ED visit. So here's some details. The only thing with the seeds that are attached to your card is if you have a latex allergy, the backing on that adhesive is latex. I have some non-latex ones here. Come up and get those if you want to do this intervention and play with it, but you have a latex allergy. Why am I giving this to you? Because this is just one of many studies that has shown recently there's been a rise of studies for acupressure seeds since COVID, since provider burnout has become more escalated. And what we found is that medical providers that use acupressure seeds say they have more patience with their patients. They have better sleep, less insomnia, and they experience less stress. So if there's any way I can give you an intervention that's going to help your workplace go better or your day go better, I want you to have that tool. In fact, I want all families to have access to this tool. This is easy, it's safe, it's effective. There's almost no contraindications. It's inexpensive. It's a tool that we need to get out because once you start using it, you'll see it really works. All right. I want you to just take a moment. What's your favorite that we did today? Did you have a favorite breathing exercise? Belly breath, hand breathing, box breathing? Did you have a favorite Qigong movement? Did you have one of the 3 points that was your favorite that you want to walk away with? Or do you have any thoughts about how you can support patients accessing integrative medicine? All right, I just want you to think about that. And I'm just so grateful for you being here. I hope it was fun. If you want to learn more, register for the 14th Pediatric Pain Masterclass happening in December. We'll be talking in depth about massage therapy, acutherapy. So if you want to learn how those modalities work, please register, come for that. I did a lecture just on acutherapy that's part of the Stodd Center Global Lecture Series. You can access that if you want to understand acupuncture medicine. It's a great NPR story, better to listen than read. That was about our team a few years ago. And that's me. So thanks, you guys. I hope it was fun. Your Qigong movement is beautiful. I'm going to stay if there's any questions, and we can take like 3 or 4 minutes of questions right now. Any questions? Come on, I know you got one out there. I guess I explained everything, huh? Yeah. Yeah.
Wonderful presentation, Evelyn. Thank you for the modalities that you taught us. I guess I'm curious, as we utilize these techniques, what ways that you envision preserving some of that the cultural history of where they come from, so as to not appropriate practices and honor the practices that people have been using for a long time?
Yeah, this is a great question. So just for the Zoom, for anyone that's on Zoom, is, as we integrate these therapies, especially ones that come from traditional Chinese medicine or other traditional medicines, how do we maintain the cultural heritage of these and not have it be lost? And this is a question I grapple with every day. As a white Western woman practicing, I practice traditional Japanese medicine and traditional Chinese medicine. It's really something that I deal with personally and also think about a lot in our profession in general. And one of the things that we've done is specific to Chinese medicine and our acutherapy service. If you read one of my notes, you're going to see language in there that is unfamiliar to you. And it's because Chinese medicine needs to have, it has a totally different framework that it sees the body through. And we're trained in Western biomedicine now in our programs. But the language that we use and the lenses through which we diagnose are inherent to the efficacy of the medicine. And sometimes it can sound esoteric because we talk a lot about how the body relates to itself, right? So, and that two patients can have the same Western diagnosis and we're going to treat them two different ways in Chinese medicine. So one of the things we do is we're continuing the language of traditional Chinese medicine in our note taking. We are, in terms of when I lecture about traditional Chinese medicine, I really do bring forward a lot of those elements that are rooted in traditions that go back 2,000 years. So it's easy to say like this is a traditional medicine. A lot of us have a bias against that. Western medicine, not here, but in general has had a bias against a lot of traditional medicines over the last 100 years. And it's important to recognize that like acupuncture has been practiced consistently for over 2,000 years. And that's a lot of clinical data that has been incorporated into texts throughout this time. So this is an evolving practice, and we're not practicing it the way it was done 2,000 years ago, but many of those elements have come forward. So it's still combining with every finding of modern medicine, but it needs to have its own language. The model and the lenses through which we understand these things need to be accepted. There needs to be space for it. So if you find on the floor that you're hearing a bias coming up within yourself or with your team, it's important to pause and say, actually, I'm not really well educated on this. So just because I wasn't exposed to it in my training doesn't mean that it's not valid and that it doesn't help patients. So this is an ongoing discussion, and this is a challenge. And I would love to see a time where we have more lecturers coming in from Japan and from China who are really rooted in even different and richer trainings, perhaps. I go overseas to train, but I can't bring all of that back. I look forward to a time where there's enough demand that we can bring in lecturers from other countries to explain how this is being practiced, because it really is far more integrated in other countries, especially in China. And some of the other initiatives we're taking, and from like a DEI point of view, is like with these ear seeds, we have different color skin tones that we use on the floors. They're more expensive. So I've given you on these handouts, one, like the most common one that's the least expensive, but we're looking to find every way for people of color to see themselves in this medicine. If you Google integrative medicine, you're not going to see a lot of skin tones in there. It's very big. It's been very white dominant in its integration in the US. We need to break down that barrier. So a lot of the images that we're creating now have multiple skin tones. You see different like people represented, different ages represented, because when we don't see ourselves in a medicine, we tend to not access it. So that's kind of more of a DEI than just a cultural heritage. But those are some of the considerations. Is like, where can we invite in those groups of people that we already know are disadvantaged from their lack of exposure or access to this? So yeah, really good question. I think we're probably at time. I'm going to thank everyone for inviting me here today, and thank you all for showing up. I'm going to stay here. I'll take some more questions. All of you at Zoom, thanks for joining. Sorry you couldn't do the whole Qigong program with us. We will have an International Integrative Health Day will be happening in the meditation room on January 23rd. So come and join us for that. If you're here on Tuesday, the 23rd, we're going to be offering ear seed clinic, creative, joyful movement, acupressure, Qigong. We have a beautiful program put together to help raise awareness and to help you guys have a better day and learn more tools for yourself. So that's coming up in January 23rd. Thanks everyone. Have a great day. Happy Thursday.